Welcome to the Triage Method podcast with me, Gary McGowan, and as always, my co-host, Mr. Patrick Farrell. Paddy, how are you?
As per usual, Gary, I am absolutely fantastic. I hope everyone listening to the podcast is in the same position, that they are absolutely fantastic, splendid, exultant, exuberant, whatever word, best fits them. I want it to be a positive word.
That's fantastic. It's very kind of you.
I know I'm a good guy. How are you, Gary?
I'm very good. I have had a good week. I'm drinking coffee in my new mug, courtesy of a friend.
Your prescription coffee.
I just need to have my coffee before I can talk. Um, so, so yeah, this week we're going to be talking about the brain, and specifically we're going to be talking about the role of exercise in neurological disease. Now, naturally, like that is such a vague term. Neurology is a whole field. There are thousands of different pathologies you could discuss, at least hundreds of which might be, somewhat common. But there are a few kind of core areas that are useful to talk about with reference to exercise, because exercise is not just a peripheral event. And this is something that is a key distinction, and it's something we touch on in many areas of health. And that's to not focus solely on one organ system or series of organ systems, but to ask yourself, what does this intervention do to the organism as a whole? And that goes for exercise. When we think of exercise, we might think of the muscular events or the metabolic events or the cardiorespiratory events or the vascular events. They're probably the main ones people think about most of the time. But we know that the brain and the nervous system are also heavily influenced by exercise, both acutely and chronically. And therefore, we would expect exercise to have at least some effect on some of the things we consider to be important in the domain of the brain and the nervous system, such as learning, memory, cognition, and then disease states like Alzheimer's, Parkinson's disease, stroke, etc. So in this episode, we'll run over some of those things. Of course, we can only cover a very small amount of detail in a single episode, but we will likely then focus in on specific pathologies in future in areas that are particularly of importance, like MS, stroke, Parkinson's, etc.
Yeah, and if I can even speak, I think it's actually really important to understand just this key kind of point here, which is there are clearly direct effects on the brain and the nervous system, right? And there's also, we can call them peripheral effects. It's all the stuff that people generally talk about when they're talking about, training, the metabolic stuff, the cardiovascular stuff, etc., right? And all of that, like cardiovascular, metabolic, etc., stuff that we generally talk about, that also clearly affects the brain as well, right? So it's not just a complete separation going like, oh, these are only the direct effects and these are all peripheral effects that, we only care about those. Like, you need to get blood flow to your brain. You need to have, good metabolism, or, the ability to metabolize different substrates for good brain function, for good bodily function, etc., right? So we're going to kind of try to pull these things apart in this podcast purely so we can actually discuss them. But in reality, it's all interconnected. These things don't happen in isolation. It's all happening at once. So some of the effects you get from exercise might be more neurological in nature. Some of them might be more metabolic in nature, but they're still intertwined. They're still affecting each other back and forth,
Absolutely. And that metabolic component is very important, because that's one of the areas that exercise and nutrition plays a key role in terms of the prevention of long-term neurodegenerative disease. Because we often think of metabolic components like, let's say, insulin resistance, dyslipidemia, etc. We think of them in terms of their effects on the peripheries very often. People will talk about things like high blood pressure affecting the heart, or the process of plaques building up in arteries, or atherosclerosis. But what we often don't talk about is how that impacts the brain. And it absolutely does. And we know that chronically poor metabolic health and poor aerobic fitness, of relevant to this conversation, is very high, or increases one's risk of developing neurodegenerative disease, such as the cognitive decline and memory impairment in Alzheimer's disease. So the metabolic is very important. Now, in terms of introducing this discussion, I think there are a few different subdomains that you can consider when it comes to neurology and exercise. And they would be neuromotor. So that's the relationship between the nervous system and or the brain and motor function. So there are specific areas in the brain that are responsible for motor function at a very high level. And then there are lower levels of the brain that will be responsible for integrating motor function, integrating sensory and motor information, and then the output of balance, coordination, etc. So this is absolutely a very complex system, but we also know that it's plastic. And when I say plastic, what I mean is that it's malleable. It's something that can change over time. It's not fixed. And this is probably one of the things that will come up throughout this conversation, is this idea of the brain being plastic. This is referred to as neuroplasticity, because in the past, the brain was basically thought of as being, developed at birth to some extent, but then throughout childhood and adolescence, and then eventually it would come to the point where you're at 25 or so, in your mid-20s, your prefrontal cortex is now fully developed, and your brain kind of doesn't really have the capacity to change, but it does have the capacity to change. And we know that exercise is one.
Just to make it clear what you mean by that. Basically, what you're saying is previously we thought, let's say 0 to 25, or even like prenatally or whatever, your brain is kind of like wet cement, right? Mm-hmm. And then once you get to 25, it's solidified, you're done, you can't do anything after that, right? But what does that actually mean? Are we talking about like the brain cells? Are we talking about the neurons? Like, what are we talking about here?
Yeah, so there's a number of different places where this comes up being important. So, for example, if you were to look at the motor cortex and that motor cortex meaning the brain that governs motor function, if you were to look at the size of those areas and the density of neurons in those areas and the connections between those neurons or nerve cells, you look at those in, let's say, a piano player or a surgeon, and then you look at them in, I don't know, a power lifter, let's say. You've got one group of individuals, the pianist, let's say, who has a strong development of fine motor skills. Their fingers have had to, you develop fine motor skills over many years in order to become a competent pianist. And then you were to compare that to the gross motor development of, let's say, a powerlifter. You're going to see differences in terms of the way those brain areas have developed over time. And that's not just the precedent for the performance, in that it's not that the pianist is a good pianist because their brain was built this way, but there might be some of that, but also that over time, as they use these motor pathways over and over and over and over again, it sends a signal to the brain that we need to continue developing those areas. So it's like muscle. If I use my biceps all the time, I strengthen my biceps and I'll lay down new muscle proteins. This also happens in the brain through the process of neurogenesis. And we know that exercise is one of the variables that modulates neurogenesis to allow for the synthesis and the strengthening of connections in those areas. Another thing that comes up is after stroke, let's say, what you can have is damage to certain areas of the brain. And initially after a stroke, someone might have certain deficits. Let's say they have a very weak right arm because the area in the brain governing their right arm was damaged. But what can happen over time due to the brain's neuroplasticity is those neurons that no longer have connections to that area of the brain can start to they almost like move around and branch out beyond the damaged area, and they can form that connection to again strengthen that motor function. So the idea here is that to some extent, and it is a limited extent to be fair, the brain does have the capacity to change and to grow over time. It's also something that's seen in the hippocampus, which is an area governing memory in particular, which is really important. You see this neurogenesis that's taking place, which is the development of those new neurons. So there's kind of a couple of components to plasticity. Neurogenesis in terms of the growth of the brain. That's kind of a question that's I think still very much unanswered in terms of what the capacity of that to take place is in terms of like actually growing the brain. But specifically in terms of plasticity and its ability to change and to be dynamic, we know that that's something that absolutely does take place and plays a key role in the development of skills, of course, but also rehabilitation from injury in the case of stroke and other neurological diseases.
Yeah. So the way I kind of think of it, and again, you have to always remember that I'm actually an idiot. Previously, we thought that the brain was solidified, right? Again, there's different ages for this. People quote all the time, like, oh, it's 18, it's 21, it's 25. When people say 25 and you try to find the research on that, it's actually, where are you getting this number from? So regardless, we used to think, okay, it's solidified at a certain age when you're quote unquote now mature, right? But what do we actually mean by that? What they kind of mean by that is, you build these, let's call them pathways in your brain, right? There's a common turn of phrase that neurons that fire together wire together, right? And basically what that means is these neurons are required or are needed for this activity to occur, whatever it is, fine motor skills, like Ari was saying with the piano player, or gross motor skills with the power lifter. Like, you are firing in a certain way. You are requiring these neurons to fire in a certain way to coordinate that movement, for example, right? Now, wouldn't it be great if they were really good at firing together, right? Oh, it would, clearly. That's going to lead to better communication, etc. Right? So they wire together. They get these little spindles that come off and effectively attach to each other. They don't actually attach, like they're not actually touching, but they're attached to each other. They can communicate much more readily to each other, right? And then you go through this process of synaptic pruning. You basically find the best pathway of communication between these different neurons, and you get rid of all the other pathways, right? That seems to be, or rather, it seemed to be the case that, once you've got these pathways, once you've wired your brain up, it's found the best way to do these different things, that these different tasks that you've demanded of it in your first 25 years of life, you're stuck with those pathways now, right? And the way I kind of envisage that is, it's as if, we'll use a first analogy. It's as if you've now just been planted down in a city. The roads are already in place. The different pathways are already in place. You're there, right? Like, it's set. You're not exactly going to completely like cut through a building now and go, we actually need it. This would be much faster to go this way. There's a building in the way. You can't do that, right? That would be a solidified brain. It's basically a city plan. You can't get rid of buildings, etc. Right? But that's not really what seems to be the case. There is a degree of neuroplasticity, right? And what we mean by that is there is an ability to effectively cut through those buildings, right? So what I kind of think of it as a slightly better analogy is, it's as if you're going through a jungle, right? Now, if you're going through a jungle, you're going to have to do some like weed whacking, get your machete out, cut the pathway, right? Now, the first time you cut the pathway, it's really hard, right? This is why new things are challenging. You don't have a pathway. You have to weed whack all the way through, or bushwhack if you want, all the way through the jungle, right? So it's very thick overgrowth, etc. Right? You do that once, very hard, right? You do it a second time, it's a little bit of keeping the road a little bit nicer, etc. Right? You do that 1,000 times, that path that you've cut, really, really well maintained, really, really nice, etc. You've even got a path down on it. You've got the stones, you've got the road, etc. Right? But if you now require yourself to do a different task, or perhaps even a task that you haven't done in a while, if you haven't done the task in a while, you're now going back to a path that you haven't been maintaining, right? So you have to get the machete back out. You have to cut through that pathway again, right? Same with a new task, you have to create a new pathway entirely, right? So that analogy helps me to kind of think of this neuroplasticity. We always have the ability, in most regards anyway, to cut a new path, right? But it is hard. This is not to say that it's an easy task. It's not like your brain wants to be, quote unquote, rewired, right? It's the pathway configurations that it has set up for your first 25 years of life or whatever, they're pretty solid. They've got you through 25 years of life. So your brain's like, this is good. This is clearly beneficial in this environment. Why would we create a new pathway here, right? But if you require yourself to do different skills or different, tasks or whatever, you can effectively teach an old dog new tricks, right? You can cut a new pathway, right? But where does exercise fit into that neuroplasticity?
Yeah, so exercise has, I think, three different kind of mechanistic effects, you could say, or mechanistic categories that allow it to impact some of these disease states, but also generally neurological development or neurological health. So you can think of neurogenesis, which is basically the development of neurons, and neuro meaning the nervous system or the nerve, and then genesis meaning, the making of something new or creation. And so you've got neurogenesis, you've got angiogenesis, which relates to the development of blood vessels, and then you've got neuroplasticity, which is this sort of ability to be dynamic and malleable that we've been discussing. So they're kind of the three categories that exercise influences. We know that exercise increases all three of these domains through some shared and some slightly different mechanisms. So, for example, we get increases in BDNF, which is brain-derived neurotrophic factor. We also get increases in IGF-1 or insulin-like growth factor 1. And then also some of these neurotransmitter effects in terms of increases in serotonin, norepinephrine, and also the synthesis of acetylcholine. And then we've got other things like VEGF, which is vascular endothelial growth factor, which relates to the development of blood vessels. And all of these things act together in concert. And of course, there are more actual mechanisms involved, but these different effects act in concert to allow for some of these changes within the brain, or positive effects within the brain, that would improve things like psychiatric conditions, let's say. So we might look at depression and anxiety. That's one thing that's going to be improved. And we know that exercise increases or improves both depression and anxiety. Then there's the neurodegenerative conditions like Alzheimer's, for example. We know that exercise reduces risk of Alzheimer's, but also can improve memory and cognitive function in Alzheimer's disease, which again somewhat relates to the capacity of the brain to have neurogenesis, angiogenesis, and neuroplasticity. And then the kind of neuromotor side of things in Parkinson's disease, for example. So Parkinson's disease is a disease primarily of a lack of dopamine in a specific area of the brain called the substantia nigra. And this lack of dopamine leads to a number of different symptoms in Parkinson's disease, such as hypokinesia, which means you get this kind of slowing or a slowing or reduction in movement. You get a tremor, you get a postural imbalance. There's lots of different motor effects that result from those brain changes. And we know that modulation of these different areas of neurogenesis, angiogenesis, and neuroplasticity can support the improvement in motor function in Parkinson's disease. And I suppose the more peripheral things like your increases in muscle mass, etc., and muscle strength that also obviously improve function in Parkinson's disease. So these are some of the kind of very, I guess, gross mechanisms or roles that exercise might play. And then we can get more specific in terms of some of the disease states that are of importance.
Yeah, maybe just quickly go through, I know you just did it briefly, but an overview of neurological diseases, if that makes sense.
Yeah, absolutely. So I think, like, of course, you can get into the weeds here of many different neurological diseases, but what we're trying to think about are what's common. What do people like? I think that if we go through these, you're going to know at least, I would say, 3 to 5 people in your family, friends and acquaintances that are affected by one of these diseases. So we've got dementia, and there are different types of dementia. Alzheimer's disease is the most common type of dementia. Even within Alzheimer's, there are further subcategories, but there's also vascular dementia. And vascular dementia is a type of dementia that kind of emerges from a lot of the same risk factors as those as that of cardiovascular disease. And as a result, exercise and nutrition can play a role here in terms of the prevention of vascular dementia. So if you've got all those classic risk factors, you smoke, you don't exercise, you've got lots of arterial plaques as a result of, high LDL cholesterol, you've been eating a crappy diet all your life, etc., you're going to be at risk of vascular dementia. Diabetes as well, really important one there. But they also cross over and influence Alzheimer's disease. So you've got dementia, you've got brain damage. So brain damage can be the result of trauma, for example. So you've got traumatic brain injuries, but you can also have other types of brain injuries, such as if someone has a cardiac arrest or a heart attack, let's say, that lack of oxygen to the brain for a certain period of time can lead to brain damage. Same thing can occur after a stroke or other types of events. We've also got strokes then, as I mentioned. So a stroke is effectively where you've got a lack of oxygen or blood supply to the brain, which can be the result of someone bleeding out or having a clot. So hemorrhagic or ischemic strokes. And these strokes then lead to damage to certain areas of the brain wherever that blood supply was distributing to. So as a result, then that might impact, muscles, for example, or it might impact things like vision, speech, cognitive function, etc. We've got spinal cord damage, which can be, partial or complete. And unfortunately, the spinal cord is not very good, to say the least, at growing back. It's not particularly plastic, let's say. Like it does have plasticity, but in terms of its ability to rejoin and to grow back, it's quite poor. And that's why when people get spinal cord injuries, you typically see lasting effects. But you do still see some improvements, which is partially the result of neuroplasticity. So you'll see some people who have had spinal cord injuries and they have no movement, and many years later they're gradually getting back some movement, and this is partially the result of that plasticity in action. You've got epilepsy, which are basically seizure syndromes, which have many different etiologies, but generally what we see is that, like, you can kind of think of seizures as being really intense, overactive brain electrical signals. Okay, that can be one area of the brain. It can become generalized throughout the brain, but we know that in people who have epilepsy, that exercising regularly does actually reduce frequency of seizures, and of course that depends on the nature of the syndrome, but exercise does have a role there as well. And then you've got your movement disorders such as Parkinson's, various different types of tremor, which are beyond just Parkinson's. You've got motor neuron disease, or ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease, as many people will know it. And then you've got multiple sclerosis as well. And those are all kind of movement disorders, but they're also neurodegenerative in nature as well. And exercise does play a role in each of those respective conditions too. And then you've got your neuropsychiatric components. So they might be your depression or anxiety, which is probably what people think of first. But you've also got ADHD, autism, Tourette's, and various other syndromes. And again, all of which seem to benefit from exercise. So they're kind of probably the most common things that you'll come across. Of course, there are plenty more, but not only are they relatively common, but every single one of those that I mentioned benefits from exercise, which is good.
100%. But how does exercise benefit these? Or like maybe pick a handful of common ones. Well, maybe not so common, but big hitters here, and then talk us through how exercise plays a role.
Yeah, so I think in particular, like although it's actually interesting in terms of discussing prevention, but the prevention or the preventative aspect of these different conditions is somewhat of like I guess you could discuss it as like a shotgun effect, in that the role of lifelong exercise, yes, it has those effects on the brain that we're talking about, but like I mentioned, when it comes to discussing exercise as a peripheral event, we're being just as reductionistic if we focus solely on what exercise does to the brain in terms of preventing these diseases, because it's not just through those effects. It's also through the improvement in metabolic health throughout your lifetime, for example. So better blood glucose regulation, better vascular function, lower blood pressure, all these types of things are what lead one to not being at as much of an elevated risk for a lot of these neurological diseases. Stroke is obviously one that's very notable. One of the largest risk factors for stroke is hypertension or high blood pressure. And we know that exercise is an incredibly potent intervention for reducing blood pressure. So it's somewhat to do with a lot of the traditional risk factors that we often talk about exercise improving, and then some of those specific effects as well. So when it comes to stroke, as I said, it's kind of very much those traditional risk factors in terms of the role that exercise would play. But in terms of the follow-on from stroke, that's where exercise plays a far more nuanced role. Because when you're introducing exercise for someone who has had a stroke, you often have to be actually very specific in terms of exercise prescription, because each person with a stroke can have different deficits. And this is something that physiotherapists will typically work on to find a stroke patient where they're at and to gradually scale up exercise to the point where hopefully eventually someone will be back doing more conventional movement, let's say. So an exercise program for someone who's had a stroke might encompass balance tests and subsequent balance exercises, gait retraining, where you're retraining someone to walk, to stand up, to transfer in and out of bed, etc. And then your more conventional, aerobic and muscle strengthening type of exercise, along with specific skills related to fine motor, hand function, etc. So stroke is a really interesting area in terms of exercise prescription, and it's probably one of the best cases of neuroplasticity in practice. Because when you see someone, and I've seen this myself, who has had a stroke and has severe deficits, they could have full hemiparesis, meaning that their whole one side of their body they basically have no control over it. They have no strength at all. And then just a few weeks later, with repeated exercise, repeated exposure, the brain begins to find new ways of making these muscles work again. And it's a fascinating thing to see. So exercise there, just incredibly important, but also very individual in terms of finding the person where they're at. Now, in terms of Alzheimer's disease, which is extremely common and probably only becoming more common as a result of people living longer, number one, because that's a very strong risk factor, but also all of the cardiometabolic risk factors that have emerged over the last 50 plus years. So Alzheimer's disease is something that's actually, you can think of Alzheimer's disease, or people often think of Alzheimer's disease, I should say, as something that just happens. It's just one of those things that, oh well, it can get anyone, and that is true to some extent. And people don't just get Alzheimer's because they weren't fit or because they didn't eat well. There are fairly strong risk factors in terms of family history and genetics here, but we know that exercising in terms of a lifelong capacity seems to have one of the most potent effects on reducing risk of Alzheimer's disease. But not only that, something that's really interesting is that if someone does have Alzheimer's disease or any type of dementia, really, you can actually regain cognitive function or memory as a result of regular exercise, which is really interesting and is somewhat a testament to those factors we mentioned previously, the neurogenesis, angiogenesis, and neuroplasticity. So I think it's although Alzheimer's is a progressive condition and many types of dementia are progressive, there are also points of intervention. There are some medications that people take to, preserve some cognitive function, but exercise plays a key role here. So it's not just a fixed downward path. It is something that can be improved. In terms of Parkinson's disease is again one of those areas where it exercises one of your core interventions, because Parkinson's is really a movement disorder. It does have cognitive or neuropsychiatric symptoms or effects, but the main thing people think of when they think of Alzheimer's or Parkinson's disease is probably the tremor, the stooped posture, shuffling gait. They're the classical symptoms. People become quite rigid, and the decline in their function often then can spiral as a result of them not being able to do the normal daily or activities of daily living, maybe not being able to exercise or go out walking in the way that they used to, and then being more sedentary. And then that spiral just continues. So exercise as an intervention here can reduce risk of falls, which is something that's really important in Parkinson's disease, but also begin to, rebuild muscle strength or muscle size and preserve motor function for longer. So it is really important in Parkinson's disease. And, there are trials of both aerobic and resistance training, which are of benefit here in Parkinson's disease as well. Parkinson's disease is it's actually quite a specific condition in that it's pretty much related to one neurotransmitter. Now, it's not just that, there's a lot more to it, but it is a state of a lack of dopamine in a particular area of the brain. And then that relates to many other areas of the brain. And exercise seems to have some effects that relate specifically to that system and some of those connections. So it is a very potent intervention. Now, one of the others that we've had some clients that have had this condition, and it's very common in Ireland, which is multiple sclerosis. And this is one of the areas, multiple sclerosis or MS, people might know it better as MS really, but MS is quite common. And one of the unique things about MS is that we've talked about Parkinson's, we've talked about dementia, we've talked about stroke, and these things typically hit late in life. That's not necessarily the case with MS. A lot of people will be diagnosed with MS in their 20s, 30s. Young women very often are the demographic that MS can affect. So this is an area that's obviously of great relevance, because if you have MS, let's say, it's very different to an 80-year-old who has Parkinson's disease and maybe they're coming to that stage of their life where they don't really have much of a future vision, let's say. They're not looking at the rest of their life that remains in terms of like what they're going to do with their life. They're more so trying to preserve daily function. Whereas if someone's 25 years old and they've just received a diagnosis of MS, well, they're thinking, oh my God, I had all these plans. I wanted to go and do this traveling. I wanted to work this job. Will I be able to do that? Will I be able to play with my kids, etc.? So it's one of the areas where like, right, I want to try and do everything I can. And MS is a condition which can lead to weakness and to loss of muscle mass. There are some muscle specific effects of MS. And there's also this fatigue that impacts people with MS, which can be quite debilitating at times. And MS has a couple of different types. One of the most common being relapsing remitting, where people will go through periods of relapses where they have much worse symptoms, and then periods where they have none. So exercise plays a really key role here in terms of improving aerobic fitness. That's one dimension, but resistance training as well plays a really key role in terms of increasing muscle mass, which does take place in MS. And I think that's an important point to make. You can still gain muscle despite this being a chronic progressive neurological condition. And that then can improve fatigue in people with MS. But one of the things I often say to people when I discuss exercise in MS is to use kind of like a traffic light system, because in MS, as I said, there's these periods where symptoms are much worse, and there's these periods where symptoms are much better. So I would have different workouts that are like in the red, in the yellow, and in the green. So the green workouts are the ones that you do when you have no symptoms. You're feeling great. Fatigue is more or less absent. They're like your hardest workouts. And this applies to everyone really. But then in the yellow, you've got your workouts that are kind of in the middle. Maybe you're not having the best day. And then in the red, they're your workouts or your very light activity for when maybe fatigue is a bit higher and you're having more symptoms associated with your MS. And using that type of system can allow someone with a condition like MS, which can be variable, to continue exercising throughout their life. So it is something that's important. It's going to absolutely improve your function and your quality of life going into the next few years or your later years with MS. And yeah, absolutely something that's worth doing. So I think that's
on that traffic light for a second. Just on that traffic light system, especially, like there's two components to this. Is like you said, we've had a variety of a few clients I can think of, at least off the top of my head, that have had MS, or rather I should say that have MS. And using some sort of system like that is really, really important. It does apply to most trainees. We want to have some sort of auto regulation. And we can do a few different things with that in terms of the auto regulation. First of all, we can just have a, RPE. That's the, generally what people kind of think of when they think of auto regulation. We're going, okay, look, if today's the day you're just not able to lift those weights, they feel really heavy, go lighter, but still hit an RPE 7 or 8. So it's a relative rating of perceived exertion. You're like, okay, today's not my day, I'm going to go a little bit lighter, or today is my day, I'm going to go a little bit heavier. Now, with MS and other conditions, we might also really start bringing in more of a volume component to that auto regulation, going, look, if today's just not your day, just do one set, maybe drop the weight as well, but we do want to still get you doing some sort of movement, right? And again, other days you might be like, I am absolutely on fire, I'm ready for this. You might do a little bit more volume on those days, take advantage of it, right? So we want to have some flexibility built in there. But another thing that I find is really important, especially in the case of MS, where there might be some, for example, balance issues, right? We might have a situation where certain exercises you're perfectly fine with when you're in this period of like lower symptoms and you're not having issues. So then we can do our more balance requiring exercises. Maybe you can do your lunges, you can do your free squats, that kind of stuff, right? But then if you are going through a period where you're noticing your balance is a little bit less than you would want it, maybe then we peel back on doing stuff like lunges or squats, and we're bringing in stuff which has a little bit more stability, right? So that you're not going, okay, well, now I'm limited by the fact that my balance, my coordination maybe is a little bit off. So that isn't normally something that people will change with some sort of auto regulation system. But I think it's really important to keep in mind when we're talking about more neurological conditions, which might have a balance deficit occurring, that might have some sort of strength imbalances occurring. Like if you have something in, say, like a stroke, for example, and you're recovered from it, but you still have some sort of strength deficit between like your left arm and your right arm, we might not choose exercises that have a huge difference in terms of, oh, we're going to get you to do, I don't know, like a dumbbell chest press, and you're like, right, well, my left arm is doing 5 kilos and my right arm is able to do 50 kilos. It's like we might do different things to account for that. And that is something that I don't think is fully accounted for in these more kind of general training guidelines around this kind of auto regulation, but it is something that's really important when we consider more neurological conditions.
Absolutely. And I think that, if you're someone with one of these conditions, I think one thing you can do is to try to find either a personal trainer or a physiotherapist who has experience at working with people with your condition. So, there's people who specialize, physios in particular, who specialize in things like stroke or Parkinson's and MS. And there's often, support groups for these types of conditions as well. So you can find others who have been in that position. But all neurological diseases vary in terms of their intensity as well. So, there's even some like fitness influencer personal trainers online who have MS, and I've spoken to them, and they train. You go on their page and you wouldn't think any different of them than any other fitness person that you would follow, but they will have periods where it's a lot more difficult maybe for them to continue their training practice. So it's very much individual dependent. Now, one thing to note here is that we've been focused very much on pathology here in terms of like the neurological diseases and where exercise might fit in. But what covers a lot more of us is probably the role of exercise in normal general health and brain health. Where does exercise fit in there? Because it does fit in. And some of the things that all of us experience to some extent would be even some of the, let's say, psychiatric conditions like depression and anxiety. Everyone experiences some degree of depression or low mood and some degree of anxiety. It doesn't mean it would reach a clinically relevant state, but it's still something that we all experience from time to time. And even in healthy people without clinically diagnosed depression or generalized anxiety disorder or any of the other types of anxiety disorders, we know that exercise can improve mood, and it can also lead to reductions in anxiety. And this is something I actually remind clients at a lot of the time, really, because sometimes people will have busy periods where they're just feeling really anxious. They have a lot going on at work, or maybe things are just stressing them out. They might have things going on at home. And the tendency is to double down on whatever it is that maybe is stressing you out. So if work is stressing you out, you spend all your time working and thinking about work. And that might be necessary sometimes if you genuinely have the most intense project and you need to spend every hour of the day on it. But I would say 99% of the time, taking 30 minutes even to do some exercise, even if it's just getting out for a brisk walk outside, is going to improve not only your mood in terms of those anxious symptoms that you're experiencing, but also your subsequent productivity and your ability to complete the task well. It doesn't mean that you should go and do a 2 hour, like super intense workout that's going to leave you super fatigued. And I think that's one of the key points here, is that sometimes when people talk about the mental benefits of exercise, a bodybuilder or someone who trains really hard will turn around and say, I feel crap after my workouts. I don't feel better after them. And that's true for me as well. If I do a super hard interval workout, I'm not really doing that for the like productivity benefits after. I feel shattered. I want to go to bed for a while. But doing some form of exercise generally leads to those improvements in mood, like I mentioned, reductions in anxiety, but then other things such as improvements in learning and memory. And this has been studied, and to some extent it's hard to study because like there's no real placebo for exercise, but exercise seems to, even in the short term, allow your brain to integrate memory and to integrate new skills, even if they're not related to physical traits. So if you're doing exams, the tendency might be, I'm not going to do any exercise, I'm just going to focus on the books. But generally what we see is that people who are fitter, who exercise more, tend to actually have better learning and memory. They tend to do better on exams. Even if you're exercising regularly, you tend to actually do a bit better, provided, of course, that you're not just taking all of your time and energy and diverting it into hard training. Because there's a difference between training like an athlete and then just exercising for your mental well-being or your learning, memory, or cognitive function. I was listening to an interview with Khabib Nurmagomedov, who is an MMA fighter, for those who aren't into MMA, or retired MMA fighter now and a coach. But
best ever, we should say.
The best
ever.
Yes, the best ever, the GOAT from Dagestan. And he was talking about his training regime when he was, in his peak or chasing his peak, let's say. And he's kind of talking about how, all these athletes, they think they're focused on recovery and they take these supplements and massage, etc. And he's saying, the thing that's recovery for me is sleep. And he talks about how he would train 3 to 4 times per day, and between each respective session, he's sleeping for a couple of hours. So basically all he is doing is sleeping and training, and obviously eating. But that's pretty much it. That's how he spent all his time as a professional athlete, sleeping throughout the day. Now, that's not you. That's not you. So you're not going exercising 3-4 times a day for like mental benefits. He's doing that because he's shattered and otherwise would find it difficult to function in his next training session. So when you're following athletes, you have to be able to differentiate what they're doing and why they're doing it from what you're doing and why you're doing it. So if you are let's say a busy business executive, or you're a nurse, or you're whatever you happen to do, you're a busy person, you constantly have to be using your brain, you constantly have to be focused on what you're doing, and you have to be able to regulate your mood and your emotions, etc. It might be that a 30-minute or 60-minute moderate intensity exercise session is what you need to be able to get that reboot and to feel focused. And everyone will have that sweet spot. There are some sessions that will be far beyond your intensity threshold for feeling better after it, and therefore you should be scaling it back a bit. That's something I try to do. If I'm going into the hospital for the day, let's say, I'm generally not going to do like a ruthlessly difficult exercise session in the morning, because I'm kind of beat up after it, really. I'd rather do that later in the day. Now, sometimes I have to, but if I do a light exercise session, like 45 minutes of moderate intensity cardio, that actually kind of wakes me up. It gets me going for the day. I feel a bit mentally sharper after. So you have to identify that sweet spot for yourself. And the reason I'm specifying this is because it's not enough to just say exercise improves these things. you have to find the threshold of exercise that improves these things, because these are parts of this discussion that are a bit more subjective and a bit more identifiable. Like you can identify how much mental clarity do I have? How much focus do I have? How productive am I? So they're the things you have to kind of tinker with yourself in order to have an appropriate exercise approach.
100%. And I think it's really important to understand both those things that you said. Well, you said a lot of things, but both those things in terms of there's a time component to this. If you're training 3 hours per day, whatever, you're probably not going to have the best memory, the best work, etc., because you are spending so long actually just exercising, and you're probably way and above the lowest required dose to get the benefits. That's not to say that there aren't additional benefits. Like we've talked about it previously, that more exercise is generally better. But if we're talking about on the day, memory, whatever, any of these kind of different brain related phenomena, if you're spending 5 hours per day exercising, you're probably not going to be doing a lot that benefits from memory, improved cognition, etc. For example, sorry, I'm coughing here. I used to work in a university gym, right? So there was lots of students in the gym, and you could see students that would spend 3 hours, doing resistance training, and you'd also see other people doing, their 45-minute session, right? And I literally know students who were spending time in the gym and missed exams as a result of spending time in the gym, right? So we're not by any means saying that just by going to the gym, you're going to have better grades, you're going to have better cognition, you're going to get better results in life, etc., right? That's not a given, right? But we do seem to see some benefits from exercise in terms of cognition, memory, etc., right? So there's that component. That's just a time component. And then there's also this intensity is the wrong word. Maybe we'll call it the dose. And that both applies to the type of training that you're doing and then the overall intensity of the training that you're doing. For example, if you're doing cardiovascular training, like I have ADHD, for example, right? This is a neurological condition. We can put it in this category here, right? If I do aerobic training, I find that for me is the most beneficial thing for my cognition, right? That for me, when I'm really aerobically fit, my brain just works better, right? If I do resistance training, that doesn't seem to give me the same benefits. If I do a resistance training session in the morning, which I often do, it's not like my cognition throughout the day is better. It's not like my ability to stay on task is better. Oftentimes I find for the first 2 hours or so after a resistance training session, my ability to stay on task, it's actually probably worse, right? So we have to, and maybe I could modify my training, not train as hard, etc., etc. It's just stuff that I'm not willing to do.
And you wouldn't be so jacked out of your mind.
But either way, you have to kind of play around with the dose, the type of exercise, the intensity of the exercise, etc., and find that sweet spot for you, for what you have going on. And unfortunately, I can't give you some guidelines for that in terms of, oh, well, here you go, for MS, do this, for dementia, do this, for stroke, do this. We don't have those guidelines. It's a very individualized thing, right? But in general, what I would recommend doing is just start it off lighter and then going heavier, if that makes sense. Or rather, lighter and heavier are probably the wrong words. Starting off at a lower intensity, doing something like aerobic cardio, so you're never pushing into that kind of acidosis or lactic threshold above that or anything. Or if you're doing weights, you're never really pushing into really heavy weights, really close to failure. You're just kind of taking it a little bit easier. Start there, see what benefits you get from it, and then you can start pushing things,
Yeah, I completely agree. And personally, anecdotally, I think the things that benefit me mentally in terms of mood, anxiety, and then particularly those mental focus and clarity components are aerobic exercises, as you said. I like that. It makes me feel really good, especially like a moderate intensity session where you finish, but you're like, I could have kept going, but I didn't, And obviously the other thing I suppose is if I can do that outdoors, like hiking in the mountains, unreal. the best of all. That's like the gold standard. Not in the beach, the dirty seaside, disgusting. Mountains, woodlands, absolute woodland supremacy here at Triage. Now, so there's that, but also jiu-jitsu, which is obviously a very kind of specific type of exercise, but the combination of the physical component of jiu-jitsu, which is on average moderate intensity in terms of like when you're drilling, and yeah, you might have some periods where it's more intense, but an average jiu-jitsu session is moderate intensity. But also the kind of cognitive component and the fact that you're getting out of your own head and you have to really focus on what you're doing. I find that to be like, from a depression and anxiety perspective, like mood and anxiety in particular, that's the absolute best for me. And that won't be for everyone, but for me anyway, that's just like the best. It's almost like a moving meditation in some ways, because my mind is just like, it's just focused on one thing. It's not getting away from, or it's not deviating to all the other problems in my life, let's say. So I'm sure there are other things, like some people report very similar experiences with dancing, for example, because you're focused on the next move. You kind of have to be very perceptive what's coming next, and many other sports too, I'm sure. But that jiu-jitsu in particular, I just find that because you're always thinking about the next thing, you're always focused on your opponent that's trying to kill you. It's just it's almost like a dance in some ways, both physically and psychologically. And I'm sure you could probably say the same about boxing and other martial arts as well, but I don't have that experience. So jiu-jitsu for me, walking in the mountains and aerobic exercise are the goats.
100%. I would agree with jiu-jitsu. Well, it's really anything that gets you out of your own head. Like if you're doing resistance training, like realistically, you can go on your phone in between your sets. You can be thinking about whatever. You can't really do that in something like jiu-jitsu or, sports in general, like if you're doing even fucking soccer or Gaelic or whatever, like you can't really be in your own head thinking about pretty much anything else except being in the moment. And this is one of those things where I never really understand when people talk about like being in the moment and being present and all that, and they just don't bring up sports, which sports are probably the most effective way like to do it. So yeah, that's just one of those things. Unfortunately, I'm the type of person at jiu-jitsu that just tells jokes the whole time and just fucking, whispers sweet nothings in your ear as I'm choking you. So it's not exactly an out of head experience for you.
Yeah, I don't. I'm just totally zen. Don't even speak. But anyway, guys, that's actually pretty much everything that I wanted to cover in this episode. There are absolutely more specific things that we can discuss with reference to different diseases, and we'll definitely at least do another episode on exercise and mental health specifically, with depression, anxiety, etc., because there are some interesting things beyond just the mechanisms. You can discuss the brain derived neurotrophic factor, whatever, these types of things, but there's also a kind of a higher layer of, let's a bit more messy, which is the psychological, and the psychological experience of exercising and getting better and doing something productive and progress, and that probably has benefits above and beyond just the mechanisms that we can describe. So that'll be another episode, but for the purpose of this one, I don't think I have anything else to add.
Me either. Well, I suppose we could just finally say that exercise in general, especially if you do have some sort of neurological condition, like exercise just in and of itself is generally empowering. It's going to reduce, other physical, especially comorbidities that can go along with having a neurological condition, especially one that, if you have a neurological condition and people are telling you like, oh, just, I'll help you with the shopping, I'll help you with this, and you're not actually going out and doing a lot for yourself. Like it kind of feels very disempowering. And also it can actually lead to worsening health overall, because you're never actually challenging yourself. You're never actually going out doing anything physical anymore. And it leads to a worsening of muscle function, muscle mass, strength, et cetera, so exercise is just a good thing in whatever form you can do it, especially if you have a neurological condition. Again, it's one of those things that so few people realize the benefits of, and I don't mean just they cognitively realize the benefits of it. Like everyone knows, oh, exercise is good for you, but I mean how good life could be if you were to exercise. Like most people are aware there are benefits to exercise, and yet they still don't do it. But if they were to do the exercise and then actually see the benefits in their own life, neurological condition or not, like, it's a fucking game changer. You know, you can see why people in the health and fitness world become like exercise zealots. They're like, oh, you need to get on the path. You need to be exercising. You should be in the gym all the time, because it is one of those things that is truly life changing. You know, like you are literally, yeah, like you are a different person on exercise and off exercise. You know, like I even noticed that personally, and I'm not someone that ever like really ever tends towards depressive thoughts. Like I can count on my fucking hand, you know, how many depressive thoughts I've had. Schizophrenic thoughts now, maybe they're a bit different. Depressive thoughts, very rarely, right? But I came back from Paris, was it in January? And I had to do a COVID test, came out positive for COVID, had COVID. I had no symptoms apart from a little small cough. I can go back on the podcast. We discussed it. And I had to stay in the house for 10 days. And that nearly fucking broke me. I was like, oh man, like this is so depressing. I'm like so low mood because I wasn't able to do the types of exercise that I enjoy doing. Right. Now, it wasn't full blown depression or anything. It was just low mood. I was just like, oh, like, fuck this. Like, I actually enjoy exercising. I can't go out and exercise. And yeah, I still did bits in the house, but it just wasn't the same. Right. So me on exercise versus me not on exercise, again, not someone that I want to be not on exercise.
Yep. Exercise, it is as close to a miracle drug as we're ever going to get. And I am absolutely an exercise zealot, and I'll never get off this high horse. So get to the gym today, or get out in the mountains for a walk. That'll be even better. And yeah, your brain and your body will benefit from doing so. So other than that, guys, of course, if you need help with your exercise programming or nutrition or both, we do have coaching spaces available. That includes full training and nutrition coaching or nutrition coaching in isolation. So if you'd like to work with the Triage team, you can find more information in the description box below. We also obviously put out this podcast every week. We appreciate when people share it and when they leave a rating and review. So if you could do that, that'd be fantastic. Also, make sure you subscribed on your podcast app, because that gives us an indication as to, you know, whether or not we're putting out the right content. You know, if we're growing, we're saying, right, this is good, people like this stuff. If we're not getting any feedback, we don't know what to do next. So let us know. Other than that, we have the newsletter, which goes out every week once again, and that's exclusive content that doesn't go on our social media. So make sure that you're subscribed there too. And if you don't follow us on social media, of course, you should be doing that at Triage Method on Instagram and other platforms, but mainly on Instagram. And then, of course, we've got our own individual social media, me at Skinny Gaz, Paddy at The Real Paddy Farrell, and the rest of the team, which you will find on the Triage Method page. So follow all those. You'll be mostly on the path. But then if you really want to get on the path, particularly when it comes to your ability to be a nutritionist or nutrition coach, we recommend that you do our nutrition certification, again, which you can find in the description box below.
Fantastic. I have nothing else to say. So I hope everyone enjoyed this, and we'll see you in the next one.